everyone. Welcome back to our KAMSA podcast, KAMSA Advocacy Podcast. My name is Justin. I'm a first-year medical student at the University of Missouri, Kansas City, and the current co-vice president. And with me is Justin.
Yeah, I'm Justin, and I'm the advocacy chair for KAMSA National, and I go to UCLA Med School.
All right. So Dr. Wan, we just want to kind of ask you if you want to introduce yourself and tell your background and how you got started in medicine.
Yeah, so I the currently my professionally I'm the assistant professor of urology at Weill Cornell Medicine. I'm a full-time faculty here at Cornell. Um, in terms of comma involvement, I've been involved boy probably about over 20 years. I was a president three times, 2015, 17, and just a couple of years ago, 2024. I was also the chairman of the board. So I do have some good perspectives on comma where we were and overall history, at least for the last 20 years. Um, so that's my brief introduction.
Yeah, so thank you for giving your introduction. Can you describe a little bit more about your upbringing to medicine, like a little bit about how you grew up and your life beforehand, and how it influenced you to become like a part of the Cornell staff and leadership?
Right. So I immigrated I was born in Seoul, and I immigrated to the United States in 1974. Probably before most of you were born. The uh, I My first immigration site was Los Angeles. I actually grew up in Los Angeles, and I went to school there starting like third grade or so. So at that time, even in Los Angeles, there weren't actually that many Koreans. It was a huge adjustment. But ever since I was young, I knew I wanted to become a doctor. It's kind of instilled that as an immigrant family, most people want to go to medicine, want to become a doctor. So, I grew up there. I did study, and I went to Cornell, and and then I went to med school, and I wanted to come back to California, and then I met my future wife in New York, and ended up staying here. So I when I first started this, I went into private practice after 1 year in academia. So I went to Cornell, went Columbia, New York Medical College. I did my residency and internship there. So I joined the faculty there first time for the first full time as soon as I got out of residency. But I always wanted to explore private practice, and so I just decided to open up a private practice here in New York metropolitan area, in Queens, New Jersey. And I really didn't know anything about any advocacy, leadership. The only thing that was on my mind was set up a practice and build a good practice. That's really my initial goal was. And then this whole involvement with comedy started when I joined a local organization. So in New York, you have various medical organizations. And I joined this organization because someone said, why don't you come and join? And I thought it would give me more referrals and more of a networking type of thing. And that's how it really started. And then that's when I first realized that there's something really special going on here in terms of the people who are practicing at that time. They're much older than me now. Most of them went to school in Korea, graduate of Korea, and they're practicing here. So that's how kind of the whole thing started with me, was joining just a local organization, a few physicians, and then that has transpired into joining the National Comma.
Yeah, that sounds great. It's kind of inspiring to see how you kind of go into private practice and then you joined a small group and then it led you to KAMA, which is very inspiring. I was just wondering if you had any mentors, kind of in your early career or during training that kind of helped you to where you are currently, and if there's any lessons that stayed with you from them.
In terms of mentors, I would have to say, my family's always been a mentor, right? Your parents and your family, and they're always going to be your mentors. But specifically, if I had to pick one person who was during training, it was my chairman of the department. And one of the things that I learned from him was, oh, you always have to do the right thing, right? There's no shortcut in terms of patient care. You have to be methodical. You have to no skipping steps. You have to be honest. You have to be self-conscious. You have to do, everything you can to help that patient get better. So I remember him like even calling like three times a day just to checking up on his patients, and that dedication you see, and then that thoughtfulness, the methodical approach to things. So that kind of even to this day, that stays with me. So that kind of mental that process actually it expands to other areas, even in comma, even your public service, whatever area you're talking about, it's that thoroughness and then thoughtfulness that kind of perpetuates into whatever you decide to do in the future. So I would have to give him a lot of credit for being my early mentor.
Yeah, thank you so much for sharing. And he seems like a really nice mentor for being really patient focused and patient centered. So like branching off on that, I see that like I want to ask you a little bit further about like what inspired you to take future initiatives as well after you received mentorship from him to be patient centered in your current like practice right now as like an academic physician.
Well, I mean, yeah. So that that will never change, right? You going through med school, it's an awesome responsibility as a physician, right? I don't have to tell you this, that people come and seek your help, and in many cases depend their lives on you, and you want to make sure that you live up that to that awesome responsibility. So you want to offer the best care possible, and so forth. So that never changes. And there's a lot of, obviously, outside distractions that associate with medicine, but you never really lose focus on that because that will never change. So that is always, whether I'm in private practice. I joined the full-time faculty just recently. That just doesn't change. That's going to be with you all the time. So um, yeah,
Yeah, yeah, thank you. Especially the part about being very patient-centered, something that's very important, and I guess in my medical school that they kind of focus on in teaching. I
right.
kind of want to transition into to KAMA and KAMSA,
Yes.
and kind of see your thoughts on that.
Yeah,
So I
sure.
know that you were. Um, you were kind of deeply involved in KAMA with being part of the board, and then you're being as past president multiple times. I was wondering if um, what your biggest goals were for KAMA when you were in leadership, and how did you kind of work to achieve those goals for KAMA and KAMSA?
Yeah. Well, this is kind of long. It's a big question. So let me just kind of go back. The comma was founded in 1974, and the first physician, uh, Korean-born physician, a Korean American physician, was like in it's like 1875, Dr. Philip Song. So we had people from Korea who came to the United States over 100 years ago, if you think about it. So, and they're, what they've done steadily has transpired down the generation and so forth. So when Kama was formed in 1974, before that, you have physicians, all of them were physicians from Korea who came to the United States and it's established practice in like New York, New Jersey, California, DC. So those are the biggest. So they kind of joined sort of as more of networking, social. So it's all some sense of belonging, right? Yes. So karma is unique. The way I look at karma is it's really immigration story. It's a one sector of what we do, but it's a really immigration story of Korean Americans in this country. So to me, that's really special because I know that for me personally, you get to see all those struggles and a lot of Korean Americans went through when they first came to this country. Despite going to med school, being super smart, many of them had to start kind of all over. They had to get retrained and so forth, and a lot of times they knew more than a lot of other people. But this is the process. There's language barrier, there's economic barrier, and all the barriers that you see. And somehow they were able to overcome that and has kind of passed that down. So that's really the my main motive for getting involved in Kama. So in back in 1974, these physicians got together. It was more of a kind of a networking, and then from Kama, and then since then they had a convention from Korean Medical Association, and Kama. At that time, Kama wasn't called Kama; it's a Korean American Association of America, or Korean Medical Association of America. It's KMAA was what it was called, and they would get together, have a joint convention. So 1 year in Korea, 1 year in the United States. That really started back in the 70s, and then it continued on until the 1990s, and then there was some absence for about 20 years. But you know, the bottom line was there was a networking among physicians in Korea and physicians in the United States, and that's how the Kama began. And um, and it stayed like this until 2011, uh, when we decided to become a little more academic. Because back then it was more of a social event. They would have a convention, like in a resort. They would have scientific program as well, and so forth. So when we got on, I said, we need to do something more. I don't want to say meaningful, but something a different approach. So that is to bring more academia into the organization. So when I first became president in 2015, that's one of my top priority was to bring academia into it. So we had speakers with one of the leading Korean American physicians, and there are a lot of very very talented physicians, and bring more credibility to the organization as an academia. So that was really number one goal for me in terms of um, how this has evolved. Um, and the second goal was to get more, if you look at our board and comma in general, it's very, very male dominant. And, these days, the students and the medical female to male ratio, I think I think there are more female medical students, I believe, or slight towards that. But in terms of
Hmm.
board representation and the president, it's very lopsided. So it doesn't reflect what we see in current environment, right? So one of my main goals was to introduce more women into leadership program and so forth. So that was really initiated in 2017. We really tried to get that done, and then one thing that we always try to do, which is for me personally important thing, is students. Um, this is probably our top priority is getting students involved, because ultimately all of you are going to be the torchbearers. This is something we have to pass on to you. So getting many students involved is was very important. In fact, there's nothing more satisfying than when I hear in the conventions, now they're attending, they're grown up, they finished med school, coming up to me and said, I got involved in Kama because of what you did, your team did, so that is really, really gratifying. And when you asked me earlier, who are your mentors, what motivates you? Actually, for me personally, it was the students that really have motivated me for my involvement in Kama, and it's number one reason why I think I do what I do is really to help get student involvement, to pass the legacy of what Kama is, and so forth. So those are the three things that were really kind of personally important to me.
Yeah, like thank you so much for sharing that. And it's just inspiring to hear that Canva was like a pretty small org in the beginning or community focused and people just joined to find a sense of belonging. But then seeing that small org become like such a major org today and how you're trying
Right.
to recruit a lot of like academic physicians as well. So I know you touched a little bit about like the students involved. So I wanted to ask like, do you have any tips because a lot of our KAMSA members are listening as well? So do you have
Yes.
any tips for them or like for advancing advocacy or leadership in the future?
Yeah. Well, number one is get involved. That's number one. You have to get involved because um, to put things into perspective, KAMA is the oldest medical organization in the United States, and there are a lot of many organizations around big cities, right? Different parts of Korean Americans spin off of it. But when there's a um, like a like an issue or there's some like for example the government of Korea wants to reach out and get some advice or information on what's happening here or different companies or the only people they reach out is to KAMA, and that's what separates us from any other medical organization, right? So we have the backing of the not only the Korean government, but other organizations in Korea. We're recognized by Korean Medical Association as well. So so in terms of the students, it's a tremendous responsibility, right, to get involved. So first step is getting involved is the most important thing because what you do makes a huge difference for us. And I wish I had more time to talk about this, but I remember there was in 2015 there was one student from Australia. She was just a medical student, and we had a convention in Korea, and somehow she was able to mobilize not only Korean American students from her home country, but from other country as well, from US, from England. And they put together this, you may know this, the World Korean Medical Student Organization, right? WKMSO. And she single-handedly really did that by herself. And a lot of students did attend the convention in Seoul. And Korea actually obviously has a huge number of students, members there. So it's really inspiring how one student was able to do this, and that student really inspired a lot of us. So one person could really make a difference, and that's going to be the common theme that I want to share. The one person can make all the difference in the organization.
Oh, that's yeah, it's really inspiring. I didn't know about the WKMSO, but it looks like and it was just started by one person, which is amazing.
It was
Um,
initially, yeah.
yeah. I and also when you're just going back to when you were saying about like the students and kind of more focusing on the students. I mean, we really appreciate all what Kim has done, especially for the students, and where that's why one of the reasons why we started this podcast is to try and kind of connect more students and to bring the voices of Korean American leaders like yourself to students, and hopefully we can inspire them with your stories, and hopefully we can share. All the amazing things that kind of Korean Americans have done around the country. So yeah, we're really appreciative of Kama as well. Um, kind of going continue on Kama. I was just wondering, you were mentioning how Kama, when it started, it was just a social organization for Korean Americans to get together, and especially since their Korean American physicians are in the minority. So I was wondering how Kama has evolved since you first joined, and then where you feel it still needs to grow.
Right. So I think in terms of where we need to grow, we need to get more members involved, and that includes for both our national member, but also for students. We really want to see more student involvement because the students, medical students and trainees play a very, very important role in our conventions. It actually makes a convention, a lot better. So to have students involved. So that's the area where we want to focus more on building the membership for, so um, that takes a lot of work. That takes leaders like yourself, doing things like podcasts and like this and so forth. But that's one area that we really want to get better on.
Yeah, thank you so much for sharing that. And also, I want to know a little bit more about about your personal accomplishments as well, since you're so involved with KAMA as president and board member. What is like one or few projects or like accomplishments that you're most proud of while you were in KAMA?
So I'm gonna have to say, most proudest accomplishment. Well, I think I think there's really, I mean, many, but if I were to you know say one thing, it's probably all the work we've done to perpetuate karma to where we are right now. And it takes a lot of work. Organizations take a lot of work. It's probably what I'm most proud of, the fact that we have this amazing organization that we all belong to, just from our heritage, and we were able to sustain it. Is something, it's not easy to do. This organization always, any organization has issues and problems, and there are a lot of things to overcome. But I will say one thing: karma should be something that we work to without any personal like agenda, right? This is something that we leave I at the doorstep, and this is all about organization and how we could do. So I think the fact that we were able to reach that level, because that sometimes the organization go through peaks and troughs and so forth. And it's important to remember that we are here to serve the community and the people. And it's a vehicle to address many important issues. So Kama is a national platform to address that. So we want to make sure that our message is clear, it's pure, and we have people in the organization who share a similar value. So in terms of the thing I'm most proud of is really exactly that, is establishing a vehicle to address many of the issues that are important in today's environment.
Yeah, I think that's very important, especially for KAMA as an organization um, to remain for people and to have service like that. I think it's very
Right.
important. Um, Kind of, I know you touched on for students to get involved, and that's one of the things that you advise students to do. I was wondering if you have any other advice or any other tips for Korean American students like Justin and I, to kind of that aspire to one day hold leadership or advocacy roles, what to do to in their early careers to find their voice and to make as much impact as possible.
Yeah. So first of all, identify a mentor that you could identify. Whoever that is, okay, and reach out to that person. You could be just one, or you could be several. So I think identifying someone meaningful, that is very important. Having a mentorship, and it's our job to also provide that. So that's really number one, having a mentor. The second thing is that I know it's very difficult, but we have annual conventions, and it's important to try to attend or get involved, whether it's a research presentation or whatever it may be, getting involved that way. Because until you really kind of get involved, um, it's then you'll see really truly see the benefit of getting involved in national Kama and Kamsa. So that's my advice. Is really getting mentorship, getting involved.
Yeah, thank you for sharing. I unfortunately wasn't able to go to the convention this year. I heard it was really fun, but I went to the conference I believe 2 years ago in Chicago, and that's how I kind of got interested in getting involved and kind of being on the national board, which is really cool as well. Um,
Right,
but
right.
yeah, it looks like we're kind of running on time. But Justin, do you have anything else you want to add or?
Well, I will tell you a story. You know, last year, if you were in last year in 2024, we did our 50th anniversary, right? And when I was a president, we went to Seoul because it was a 50-year anniversary. And at that time, it was, unfortunately, there was a huge healthcare crisis going in Korea, as you may know. All the students were on a strike, the same as the trainees and so forth. So I had in my office, I had someone, one of the students, a very smart student, reached out and spent 1 year with me, United States, rotating and so forth. And she went back to Korea just literally about a few weeks before this healthcare crisis happened. So one of the things we did was is really kind of, if you think about it, it was really detrimental, right? Some people were only a few months away from graduating from medical school, and now your future's on the bleak and so forth. So we went out there while during the convention. One of our goals was to support the students, right? That whether your students are from the United States or from Korea, one of the things we felt we needed to do was support the students there, saying, despite this, things are going to be okay. Please connect with students from the United States as well, who could also give that type of support. So at the end of the day, after the convention was all over, many of them wrote me an amazing letter, saying that during the tough times, how we from a different country have supported them and cared about them was one of the really inspiring things for them to carry on. So one of the things that I would advise you could do is the world is small. You could reach out to other students in other parts, and having that strong bond between the Korean students in the United States as well as in Korea. And there are a lot of exchange programs, rotations, and so forth. That there are other things that you can do, but reaching out to them and working with them and having both of you supporting and so forth is really kind of important, and it's one really good way to grow the national student association as well. So it's something that I would encourage you to try.
Yeah, thank you so much for that answer. And like, yeah, it's just really inspiring to hear like how much you're able to do for especially students that aren't even like, I guess, close by, and how you're able to mentor them and you're able to help them grow during that like hardship. So I think that concludes our podcast, unless Justin, do you have any more questions?
Um, well, yeah, just kind of I guess a quick question. So you mentioned about the strike and the medical strike in Korea. I believe it'd be 2 years ago
Yeah,
now because I
2024
guess
started. Yes, yes.
yeah. Um, so I was wondering. I guess you mentioned a student reached out to you from Korea to kind of rotate. I was wondering if there is anything else that maybe CAMA or KAMSA did during that time to help students, and maybe if that's something that we can apply in the future or to the current,
Yes.
even though the strike is not going on anymore, just to see if there's anything that we can learn from that or to apply to this year as well.
Yeah, so so that year when we had a convention, so we did have a decent number of KAMSA students who traveled to Seoul, and then we I would work with them to reach out to students and inviting them. So we the response was so amazing. We had to shut down the registration. We had over about 400 people from various from medical schools in Korea who wanted to meet you all, um, um, and we really had to we had to shut it down literally because that response was that great. So they're very, very interested in medicine here as well. Before the strike, maybe, I mean, before all this event, maybe not as, but now, I mean, it really was skyrocket because they're really, very interested in, on the students here. So um, I think it's a learning. Both you can learn from each other, you know, because the world is a really small place and you know we have a lot of we sponsor students from there to come here, and we have many students from the United States who wants to go there. So we established the channel. We work with all the academic centers for that to happen. So if any of the students here want to have a rotation or spend time over there, all you have to do is reach out to us, and we make that happen. Um, Also, the other thing is budget. The reality is that for students to function, okay, you need money. I mean, that's really right. And I think it's up to us to as the national level to help you guys. So for example, when students came to Korea, you know, I sponsor a lot of the things so we can make the travel happen because I mean, we all been there. We know what the students, budget is like. So we want to be able to help you in that end. So all you have to do is really reach out and say, "Can you help?" Don't be shy. You just ask, and 9 out of 10 times we'll probably try to do the best we can to help you and so forth. So keep that in mind. Um, just I wanted to ask you some questions. Okay, do you have all budget or no? I mean, how are you all functioning? How are you all doing this? I mean, you need. I'm assuming you need some money and this and you know how you doing all this? How you guys raising money?
Yeah. Well, I believe we have a treasurer on the national board, and he was kind of talking about the budget. I believe there are certain kind of since we're the national board, it's kind of hard to do stuff locally. But we've been reaching out to like the local branches of KAMSA, like the California branch or the Texas branch, to see if they can do fundraisers locally. But I know Kama has been kind of supporting us as well, especially for the conference, to kind of sponsor the Airbnb and to kind of help students with the gala. So um, I know Kama has been a big part, but I guess we're just trying to work on initiatives here and there to hopefully raise some funds. But um, and also a lot of the events that we do, I guess this event doesn't really cost any money or anything,
Right,
so
right.
we try to keep it like economical and try to do stuff that doesn't really have much of a budget. So
Well, you know, in 2017, I established a KAMSA account under Kama. So there was some surplus, and I think I put in like, I mean, seed money there, and we started this. I started in 2017, and each time the presidents, whoever the Kama president has surplus, we try to put some surplus into that to the account. So in 2024, I also put, I think I put like several $1,000s into the account. So you do have an account at the national comma that you know I don't know what the balance is now, but you do have that. So if there's some events that you need to like a mixer or whatever you guys want to put together and you need funding, you should just reach out and ask because we want to support you because remember supporting the students is always been our highest priority because like I said before you're what we do like we were inspired by the previous generation but we also want to pass that along to you and then you'll recognize the history of karma what it is and trying to kind of keep this going so without the students and trainee involvement and fostering your your development as a physician over the career is very very important. There's no more important cause mission than that. So I assure you we're gonna do everything we can to support you guys.
Well, yeah, thank you so much, Dr. Wan. Really appreciate it. Yeah, we'll definitely bring that up to our next national board meeting to see if anyone has any ideas. I know we're thinking about doing some more events. I believe Andrew, one of our co-presidents this year, he was thinking about doing a like a micro grant kind of thing, or I think like a research kind of competition where students submit their research and then kind of like what KAMA does, that we pick top three and then the top three get a certain prize, certain amount of, I guess, money as a prize to support students that way. But yeah, we'll definitely bring that up to see if the national board has any ideas for any events that we can do.
Okay. You know the convention next year's convention is in Boston, right? October 15th
Yes.
through 15th. Okay. So we always try to get a a program. Anthony Choi is the KAMSA liaison. Dr. Choi is from Cornell, is hepatologist, and we reserve a part of the program for KAMSA. And I think you all know that, right? Okay.
Yes.
Okay, good. All right. Yeah, so I mean, you should, putting together an annual program and having it at the same time same time as us would be great. I'm sure there'll be more research competitions in this, and obviously there'll be social events and so forth. So I would, start planning out for that, and before that, if there's any type of social events and mix up, I know it's all kind of hard to get together, right? I mean, I think traditionally in the past, the biggest KAMSA leadership they were in New York, New Jersey, and East Coast, right? But now it seems like it's all kind of different parts of country. Is that correct?
Um, I guess, are you talking about the different branches of KAMSA?
Well, there's on the board. How many people do you have on the board, on the KAMSA board?
I think we have about 10 or so.
10 of them, so okay, all right,
Mm.
okay. Yeah, we used to have events like for example, it was in New York. They would have students from NYU, from whatever, downstate, Columbia, Cornell, and so forth. They would come to these events hosted by KAMSA. Well, we host it, but it's under the umbrella of KAMSA USA, that type of thing. So I guess that hasn't. I thought that we did that last year as well, but
Yeah, yeah, I think I know the New York, New Jersey chapter is pretty active. I think
okay,
they recently hosted a social up there.
right,
But yeah, it's a bit kind of hard to coordinate, I guess, since we're kind of all over the country. But yeah,
right, right,
we'll definitely reach out if there's any events or anything that we
right.
can come up with.
Well, you could also reach out to the Kama local chapter, like there's Kama Southern California Kama, right? So I know for you who's there, I mean, you could reach out to the our regional chapters of Kama as well for any events and things like that. So in other words,
Yeah.
bottom line is use us. We're here to help. So use us in any way you can. That's really what you should try to do.
Yes, yeah. Thank you so much, Dr. Wan. And I guess to be respectful of everyone's time, I think we'll probably,
Oh
I'm
yes, it's
sure.
done a long time.
Well, no, thank you for all your input. Really appreciate it. So, Justin, do you have any last words?
Yeah, I think we just appreciate your time here and your wisdom
Justin,
and your knowledge for the next generation of Korean American physicians. So thank you so much for dedicating your time for this podcast.
it's really my pleasure. Thank you very much.
Thank you.
It's
Okay.
so I guess Justin, did you